Namaste, I am Dr. Sharmila Pendyala, Senior Consultant Pediatrician, Apollo Hospitals, Jubilee Hills. Today I am going to talk about the not so uncommon congenital anomaly, cleft lip and cleft palate. What is cleft lip and cleft palate? Cleft lip and cleft palate are defects in the lip area and also in the hard or soft palate of the mouth. Who gets cleft lip and cleft palate? Actually, cleft lip and cleft palate are multifactorial in origin. They have an interplay between genetics and environment. Knowing this, we will know how to some extent prevent these congenital anomalies. Which gender is more prone for cleft lip and cleft palate? Male children are more prone to develop cleft lip and cleft palate, but isolated cleft palate is commoner in girls. How are cleft lip and cleft palate diagnosed? With the new imaging techniques like 3D technology, we are able to reasonably diagnose cleft lip and cleft palate antenatally, which means well into the first trimester of pregnancy and surely by 15 weeks of pregnancy, wherein we do the TIFA scan. So, usually the diagnosis is antenatal unless it is a submucosal cleft palate or a bifid uvula, which are very uncommon isolated cleft palate anomalies. What are the associated anomalies with cleft lip and palate? Yes, almost 40% can have associated anomalies, but the commonest anomalies that are associated are dental anomalies, because cleft lip and cleft palate occur in the part of the face which involves the alveolar ridge which houses the future teeth. Who treats children with cleft lip and cleft palate? Cleft lip and cleft palate are classic examples where a well trained multidisciplinary approach is going to make all the difference. The people involved will be a plastic or cosmetic surgeon, ENT surgeon, oromaxillofacial surgeons and a pediatric dental team. They have to be very closely supported by an excellent speech pathologist and an audiology department. How are cleft lip and cleft palate treated? Cleft lip and cleft palate primarily are treated by repair of the defects. So, at which age do we approach them depends on what kind of defect. Is it a unilateral cleft lip or a bilateral cleft lip? Is the cleft palate involving the hard palate only or both the hard and soft palate? What are all the associated anomalies this child has? All these determine the treatment of cleft lip and cleft palate. It is primarily a surgical correction wherein they close the defects either of the lip or of the palate by a cosmetic and a plastic surgeon. Also very important is the recognition that cleft lip and cleft palate together sometimes can cause hearing anomalies. To prevent this, what they do is they do insert small tubes into the tympanic membrane so that there is no collection of fluid which might later on lead to deafness in this particular child. How are dental care needs of children with cleft lip and palate be met? Cleft lip and cleft palate, as I said, needs a multidisciplinary team, out of which the pediatric dentist plays a very key role. In what way is a pediatric dentist going to help this child? First thing is to anticipate a probable dental anomaly at the outset. Then take care of that, because sometimes the alveolar ridge is involved. Anticipation and then treating when it occurs, preserving the erupting tooth, teaching the do's and don'ts for proper dental hygiene. These are all the things where the pediatric dentist comes in. There are a group of children who might require special prosthesis. This is where the prosthesis have to be set up properly, seen, followed up and preserved. Can we prevent occurrence of cleft lip and palate? The whole key in knowing about a particular disease is to also know about how to prevent it. And yes, it's heartening to know through some studies that there are a couple of things which we can change during pregnancy to decrease the incidence of cleft lip and palate. One of them is maternal diet. It has been associated with high intake of meat and low intake of fruit during pregnancy. So, we do the reverse, eat lot of fruit during pregnancy. Maternal smoking, maternal alcohol intake, and extremely important is stress during pregnancy. All these can be manipulated. What are all the problems that parents of a child with cleft lip and palate encounter? Parents of these children, those born with a cleft lip and palate, the first problem that they encounter are feeding difficulties. In fact, if they are not dealt with properly, these children fail to thrive. But then these days we have excellent feeding devices, prostheses, which enable parents to take care of the infant. When the anomaly is too small, particularly an isolated cleft lip, sometimes direct breastfeeding can be done, but most of the time, many a time, they do need to be fed with feeding bottles which are made exclusively for such infants. But then you can still pump mother's milk and feed it through these feeding bottles. To conclude, for all those parents out there, hope is not lost. The key to handle a baby with cleft lip and palate is to choose the proper team which has been doing work in this field and extremely stringent, strict follow up without losing hope. Stay safe, stay healthy, stay informed. Thank you. Namaste.